Hip replacement failure. This is one of the biggest worries people have about hip replacement surgery. But how long can you really trust a hip replacement for? How can you find out how good your implants are? And are the complications down to you, your surgeon, or just by chance? Hi guys, Dr. Adam here, orthopaedic surgeon. Now, when people are having a hip replacement, one of the biggest worries they often have is how likely is the hip replacement to fail. And this is especially the case given some of the high profile failures which have happened around hip replacements. In this video, I want to give you a rundown of what you can really expect about the average lifespan of a total hip replacement, looking at data from hundreds of thousands of people around the world, how likely a hip is to fail, and an easy way that you can find out how good the implants that your surgeon are using really are, and also how likely you are to need redo or revision surgery. As always, this video is for information purposes only, and you should speak to your doctor before making any decisions about your care, as they will be able to give you much more personalised information. Okay, so firstly, what can you expect on average from a hip replacement? Well, like any mechanical device with moving parts, it will eventually fail. As the polyethylene liner starts to wear out, it releases lots of wear particles that cause a reaction in the body, and the bone around the hip replacement starts to resorb, causing loosening of the implants and pain, which is the most common reason why hip replacements fail. This study from Oxford, which was published in The Lancet, found that overall, for people having a total hip replacement, the chance of still having the implant in place at 10 years was around 95%, and at 20 years was 85%. However, this depended heavily at what age the surgery was performed. So for someone over the age of 70, the chance of needing redo or revision surgery was around 5%, but for younger people, and especially males, this went up significantly. So for someone around the age of 70, the average age when most people have a hip replacement done, by far the most likely scenario is it will last you for the rest of your life. Now, as well as wearing out, hips can fail for other reasons as well, such as dislocation and infection, and these can happen with any implant and may be due to patient factors and hospital or surgeon factors. But when we're thinking about the implant itself, how can you gauge how good this is? If you're curious, there are a couple of great resources which are publicly available. Through the reports of the National Joint Registry of England and Wales, which is the largest registry in the world, you can actually see how each implant combination performs, and the ODEP, or Orthopaedic Data Evaluation Panel, tells you for each implant how many years of data support its use and the level of evidence behind this. So it's worth asking your surgeon which implants they're using, as well as their personal and perhaps more importantly, the hospital complication and revision rate. If you want an idea of your personalised risk, the NJR Decision Support tool is a great resource for this. You basically type in your information and it gives you the expected improvement following surgery in terms of your symptoms, the risk of needing a repeat operation within 10 years, and on average your risk of dying within a year following the surgery. So hip replacement is one of the best operations that modern medicine has to offer, and the vast majority of people who have it done are glad that they had it done. But if you're worried at all about the implants themselves, you can look on the websites I've mentioned, and the best thing to do is to ask your surgeon which implants they use, and they'll be able to give you the exact implants as well as their and the hospital's complication rate.